Hi, I'm Liliana. I want to talk to you a little bit about mental health and how it can affect our physiology and our biology and actually create disease. I'm very passionate about this work, and I love really sharing with people that we can change our mental map of our experiences, because really your body has all the codes. It has this incredible amount of wisdom of what has happened, even pre-verbal, even in the mother's womb, even in our ancestries, in regards of how we responded to stress and how we pass that on genetically. And so there is quite a few people that I have and hold in high regard, as Gabor Mate, that feels that every disease has a roots in what we would consider childhood trauma. Now, some people might think of trauma as something hugely significant, of some sort of abuse in any way, but trauma can be just as simple as I had a patient said that she was a bedwetter, and not only she get ridiculed and bullied in her own home, but when she was in first grade and she asked to go to the bathroom, and her teacher said no, she had to wait until recess. Well, she couldn't hold it, so what did she do? She right there and then in front of the entire class wet her pants. Well, that was so traumatizing with her that made her feel that she could never really expose herself or couldn't let people know who she was, because she may expose a secret that she had. And I always tell patients, if we hold a secret, it creates disease. And so we want to look at our life authentically so that we can really begin to understand, I am me, my parents, and those who were my caretakers, they are they. But I don't need to live out any of their dysfunction, nor do I need to live out their story. So for my patients, I get them to an e-box. It's a wonderful opportunity for us because we let the body talk. And there's books called The Body Code, or When the Body Says No and You Say Yes. So many things that are written, fabulous. But we have an opportunity and to record their voice. And what we're looking for is, it's like an orchestra. When you hear the string quartet off, you know there's just something not quite right. And it's like a little tuning fork. Is the e-box picks up the missing frequencies in your voice that represent emotions and in what organ system. And so with this information, we're able to, I'm able to share what their body's sharing with me. We're able to have a dialogue. Almost 99.9% they have an aha moment. They, oh my gosh, I can't believe, those few little things that I said revealed so much about my childhood or my mother's childhood. And I hear this so often, you hit the nail on the head, right? Because the body has this incredible amount of wisdom. And so we're really, in any of our foundational treatments here, that's the first thing we do is emotional work, so that we can start to unravel any limiting beliefs that we have in association to getting well, any issues of shame and guilt, which really should have no place in your home, because that's just slightly above the disease state. I say the disease didn't happen in your organ system. It happened in the emotional body first. There was not culpability, so the mind had to drop it down into a physical disorder. So we don't take lightly in regards to only treating the tumor and or the condition. We take it in looking at you as the whole person, starting from pre-verbal state until now. The wonderful thing about the brain is it's extremely malleable, but it's malleable through repetition. So I always tell my patients it's really important for them to observe the dialogue going on in their head. What story are they entertaining? Because anytime they're feeling a sense of yuckiness, whether it's, feeling a little depressed or I'm worried or I'm fearful, they had to have been listening to something. So I said, well, just take a moment, check in with your body. Where do you feel it? Oh, I'm getting a little upset stomach. I'm getting a migraine. My shoulders feel tight. Identify where is it in your body, because it's starting to take residence. And I like to use somatic movement. Let's move that energy around so that it doesn't get trapped within us. And then it just allows us, that's why I love yoga, that's why I love Qigong, because those are all movements that just allow this blocked energy within the body, especially within the meridians, to release and to let go. And at the same time, you're doing the breath work alongside of that. And so identifying, when I feel a yuckiness, where is it in my body? And what was the story I was telling myself? I always say, okay, don't believe, I would say 99.9% of what your mind is telling you. And if it's saying something that makes you uncomfortable, then you need to challenge it. And you need to say, how do I know it's true? Give me a scientific evidence. Now, many times patients will say, I feel, this is going on, or my husband thinks this, or I don't feel like I'm a woman anymore because of this and that. And I said, well, have you ever heard verbally your husband or anybody that you're concerned about tell you that specifically? Well, no. So what you're doing is you're comparing to yourself to what you would think is the perfect woman, right? And so they're like, yeah, so I guess that's it. So in all reality, it's important for you to have discussions with those that you feel that somehow you're not meeting up to their expectations. And I will guarantee you 99% of the time, they're just so happy to be of service to you and love on you. They don't expect a whole lot when you're not feeling well or you're undergoing treatment. And so again, that co-regulation of talking it out and really listening to what is that truth. The next thing I ask is, if it's not scientifically verifiable, number two is it happening right now? Well, no, it's not happening at this very moment, but then the patient said, but it could. Well, coulda, woulda, shoulda is in the future of what ifs. And what ifs is scary. What if what? What if this, right? So I say, get out of the future, get into the present moment, right here, right now. Connect with your breath. Look around the room. What's here? Oh, I can identify a plant. I'm sitting in a chair. I'm back in my body. I'm no longer over there in the future of what ifs, which is very dangerous. It's like a minefield out there. Your brain is a minefield. It doesn't give you permission, ask permission to speak. It just starts babbling at you. Then the next thing I say is the dialogue or the story that I'm listening to. One, it's not verifiably true. It's not happening right now. Well, how is it making me feel? And I always I relate it to the child within, a 5-year-old little girl. How would it make her feel? Oh, it would make her feel really afraid. She would not feel safe. Then that's considered a bully in your playground, which happens to be your mind. Now, guess what? We are our biggest bullies. We feel guilt, we feel shame, we have conditional love for ourselves. So in the healing mindset, in order for you to heal, we need the nervous system stable. You can go in and out of the emotions. I can be, feel like helpless one minute, but then the next minute I'm, co-regulating with somebody and they make me feel like I have hope. We always want to be able to get back to a safe home. We want to get out of the alert state. Life is dangerous. I have to always be vigilant of the future. Oh, this is helpless and hopeless. This is where you will never heal. But you can go in and out of these just like normally with all emotions, but we always want to go back to that ventricle space, ventral vagal, which is our safety space. We don't want to be in dorsal collapse, which means we block out. This is too painful. I feel helpless and hopeful. We don't be in constant sympathetic reaction. Oh my God, the shoe's going to drop any minute. We want to always say, who's our safe place? And I ask my patients, identify that. If it's not a family member or a best friend or someone that you can have as a person, and then we go to our animal. Our pets are great co-regulators, right? They don't ask anything for us. They're all pure unconditional love. I can pet them, I can stroke them, they cuddle up to me. That's beautiful. Now, if you have no pet, then the next thing is going to be nature. Go co-regulate with nature. Go and ground. Let the magnetic field of the earth heal your body as well. And so it's really important to just recognize that your emotions create your biology, which creates your condition. And so then I start needing to work with my mindset and ask myself, what is my desired outcome? When I'm aware of my desired outcome, then I start to create really healthy steps in order to get there. And if I'm in conflict with that, well, then guilt wants punishment. So that means that next lab report is not going to look so terrific. And so we always wanted to say, I'm not ever going to be perfect. No one can be, right? We're living in this physical body. But I want to do the best I can. I want to give myself credit. I want to give myself kudos. And every day when I go to sleep, I say, how did I celebrate myself today? What act of kindness did I do for me today? And when I asked myself, what did I need? Did I listen? Did I take a rest and put my feet up when I said, you just need to take a moment off? Oh, I don't have time. I got to get to my next appointment. Why? You deserve it. You've got to put yourself first. I've been giving this experiment with my patients. I say, there's many times, and this is not a conceited way, and this is not in a narcissistical way, but there's many times throughout the day, that we'll take notice of ourselves. Oh, I look really pretty in this outfit. Oh, my hair looks really nice today. Oh, that was a kind act that you did. Oh, that was a beautiful dinner you made. Well, why don't you start taking observations of just how amazing you are and take notice of that? And that's like little teeny dopamine hits, like if somebody were to be acknowledging you and We're not going to have somebody walking around telling us how wonderful we are, but you have that potentiality to be your best coach, your best mentor, your best spiritual guide, your best mother, and your best friend. And are you that? Right? And so again, if we just take notice, we begin to like ourselves. And we also want to take notice of the time that we have idle. What are we doing with that time? Where's our play time? You know, a kid that's got an idle time, they want to go out and play and run. But as adults, what do? What kind of work can we fit in there? So let's take some play time. Let's take time to notice how we feel. Who can we co-regulate? Who is safe for us? And how can we come back to spirit and recognize that spirit doesn't have a disease? The body and the mind have related this condition. And so we feed the spirit in well-being of peace of mind, unconditional love, gratitude, joy. And these are all the elements of really who you are, not the masks that we wear that we call our personalities. So I hope you've gotten a little teeny bit of a tidbit out of this. And just remember, you are amazing. Notice that. And your body will thank you for it. And if you have any questions or comments, just leave them down below and we'll be happy to get to them as soon as possible. And you have a fantastic day.